Good evening, Shauna and the entire Believe in the Gold organization, as well as everyone on your computers participating in the first and hopefully the last virtual Believe in the Gold Childhood Cancer Gala. My name is Dr. Douglas Mahoney, and as many of you know, I'm a scientist at the Alberta Children's Hospital and Charbonneau Cancer Research Institutes at the University of Calgary. Since 2012, my team has been working alongside Believe in the Gold to develop safer, more effective treatments for pediatric cancer. As you can imagine, this is not an easy task. Pediatric cancers are complex diseases that present many difficult challenges to making a safe and effective new treatment. This is especially true of pediatric solid tumors, such as the Ewing sarcoma that took JC's life a decade ago. Doctors usually treat pediatric cancers with a combination of chemotherapy and radiation, which are designed to kill cancer cells while sparing healthy cells, or by cutting them out with a knife. While these approaches are effective about 80% of the time, they tend to come at a cost, with long-term side effects such as sterility, organ damage, or cognitive deficits, often dampening a patient's long-term quality of life. And of course, for many patients, including JC, these therapies simply don't work. In the past decade, a new way to treat pediatric cancer has been developed called immunotherapy. The essence of immunotherapy is that the patient's own immune system can be harnessed in one way or another to treat their cancer. Much like our immune systems recognize and destroy a harmful virus or bacteria, protecting us from disease, it can also recognize and destroy our cancer cells. The problem is pediatric tumors are a slippery foe and can find ways to hide from the immune system or block immune cells from working properly. The job of folks like me and other immunotherapists around the globe is to develop strategies that push a patient's immune system to better recognize their tumor or function more effectively against it. There are many ways to do this, but one that's been a game changer for certain types of childhood blood cancers is called CAR T-cell therapy. Some of you may have heard of this therapy in the news. It's a truly extraordinary medicine that harnesses the power of synthetic biology to redirect a patient's immune system against their cancer. CAR T-cell therapy works like this. A patient donates their blood, and immune cells within the blood are collected and sent to a laboratory. There, those immune cells are genetically engineered to express a molecule called a CAR, or chimeric antigen receptor, which is a synthetically engineered protein that provides instructions to the immune cells to attack and kill the patient's cancer. Those cells are then grown to millions of copies in the lab before being transplanted back into the patient. If the treatment works as intended, those CAR T cells will find the patient's tumor cells and efficiently kill them. Sounds a bit like science fiction. Well, after nearly a quarter century of research and development, a first-in-class CAR T-cell therapy is now approved by Health Canada to treat certain forms of leukemia in children. Developed originally at the Children's Hospital of Philadelphia, the treatment works by redirecting a patient's immune system toward a molecule called CD19, which is found on the surface of acute lymphoblastic leukemia cells. This directs the CAR T-cells to kill the leukemia. Now, the treatment is not perfect. It can come with some pretty strong side effects, but they are generally manageable in the hospital and don't seem to cause long-term debilitating issues. Importantly, the treatment is potentially curative in over half of patients treated, patients who do not respond to conventional therapies and would have otherwise died of their disease. This is a tremendous advance for pediatric leukemia, representing the most transformative new treatment in decades. And owing to the hard work of our pediatric oncologists at the Alberta Children's Hospital, as of 2 months ago, this treatment is now available to patients in Alberta. However, despite its success against blood cancers, CAR T-cell therapy doesn't work very well against solid tumors like sarcoma, at least not yet. There are several reasons for this, which scientists are beginning to understand. One reason is that solid tumors do a better job of hiding from the immune system than blood tumors do. This makes it more difficult for CAR T-cells to find their target cancer cell. Another reason is that solid tumors are more hostile to the immune system. This makes it harder for CAR T-cells to remain functional for long enough to clear the entire tumor. Over the past 5 years, my team has been working tirelessly to address these and other issues facing CAR T-cell therapy of pediatric solid tumors, with creativity and innovation. For example, we've leveraged genetic engineering to develop novel CAR T cells that recognize a patient's sarcoma cell more effectively. We've created companion therapeutics to help those CAR T cells withstand the hostile tumor microenvironment. Our work has been funded by Believe in the Gold and other government and philanthropic organizations. More recently, our approaches have grown into a large priority research program within the Alberta Children's Hospital and Charbonneau Cancer Research Institutes. This new program, called ACTION, or the Alberta Cellular Therapy and Immune Oncology Initiative, includes over a dozen clinicians and scientists and their teams in Calgary and Edmonton, all working to develop safer and more effective CAR T-cell therapies for pediatric cancer patients. This is a really exciting program, one that Shawnee and I have dreamed about for many years, because for the first time, we now have all the pieces in place to not only build and test new therapies in the laboratory, but also evaluate them for safety and efficacy in real human patients. None of this will be quick or easy. A long and difficult journey still lies ahead, but for the first time since starting our research, we have a direct line of sight to clinical translation. This puts us in a position to learn just how well our therapies work in real human patients, or why they fail, and how to make them work better. This is what you helped launch 8 years ago when you began funding my research. It is what you now fund with your continued support tonight. Thank you, and have a wonderful evening.